Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, welcome to a new lecture today. I would like to discuss about the surgery for hydrocele. This is hydrocele surgery. So, what surgery do we do for hydrocele? If you see hydrocele, what are the indications of this hydrocele surgery? Simple. The indication is vaginal hydrocele. The indication is vaginal hydrocele. What is the contraindication of this hydrocele surgery? The contraindication is secondary hydrocele, and this secondary hydrocele should be due to a testicular mass. Secondary hydrocele due to a testicular tumor is an indication of contraindication of hydrocele. How are you going to position the patient? The patient is positioned in a supine position, and you can give either a general anesthesia or spinal anesthesia is given. Now, how are you going to prepare the patient? The preparation of the patient is we will have to drape the patient, and then you will have to paint the hydrocele and the external genitalia with the help of bethadine iodine. And then in the procedure, first you'll have to give a hydrocele incision. So incision, first the hydrocele which is there, this hydrocele is held by the assistant, is held tense by the assistant, and then you will give a 5 to 6 millimeters incision, 5 to 6 centimeters incision on the most prominent part of the swelling parallel to the median raphe. Think that this is a median raphe. You will make a 5 to 6 centimeters incision which is parallel to the median raphe, and this should be made over the prominent part of the swelling. Now, after making the incision, you will have to open the skin. You will have to retract the skin, and then dartos muscle, then external spermatic fascia, then cremasteric muscle, internal spermatic fascia. First skin, then dartos muscle, then external spermatic fascia, then cremasteric fascia, then internal spermatic fascia. All these layers are opened. At this stage, you can visualize the hydrocele sac. Now, you will drain the fluid. Once the incision reaches the sac, the fluid is drained by itself. Okay. After draining the fluid, you will just you can do. There are two things. One is Lord's plication. After draining the fluid, you can the consequence or the next step can be, it depends upon whether the sac is small or sac is large. If the sac is small, then you will plicate the sac with independent sutures. So this plication is called as Lord's plication. Okay. If the sac is large, then you will evert the sac, and then you will stitch it again. You will suture it on the opposite side. You will evert the sac and suture it behind the testis. Normally this is how you look the sac, but here you will evert the sac which is that is everted and sutured behind the testis. So this technique is called as Hydrocele operation. So this technique is called as Hydrocele operation. So if the sac is small, you can do Lord's plication, and if the sac is large, you can do Hydrocele procedure. Then how are you going to close the suture? You will have to put a plastic drain. After putting a plastic drain in the scrotum, then you can close layer by layer. First you will close the internal spermatic fascia, then cremasteric fascia, then you will close the subcutaneous layer, and then the skin. Post-operative management includes giving antibiotics and analgesics, and suture removal is done in 7 to 8 days. Now, what are the post-operative complications of this hydrocele surgery? The main complications are formation of hematoma can be formed, or sometimes it can lead to wound infection also, and it can also cause injury to the spermatic cord. Okay, it can lead to hematoma formation, it can cause wound injury, and it can also cause injury to the spermatic cord. This is about the hydrocele surgery. Thank you for watching my lecture. Thank you.
Thank you, and thank you for watching.